So we're gonna do a health check on an older puppy. So if your puppy knows place, they can be on their bed. Place. And the best time to do this is in the evening when they're tired. Right now it's morning. He has had some exercise and a training session. So we're going to get started. The same rules apply of the areas we're going to check as you do with your smaller puppy. But if you can sit on the floor and they can lay on their place because they're a little too big to be in their lap now. And we are preparing them for a client. And I realize that not all clients may be able to get in the floor, but when they go to the client has the choice to allow them on furniture or their bed, so that way they would be raised for the client to do the health check. And like I said, the best time to do this is in the evening when they're tired and more relaxed rather than first thing in the morning. So like I said, he's had some exercise and a training session. So I can start by just some petting, slow, long strokes. And what I'm also doing while I'm petting him is feeling for any lumps, bumps, scabs on his body. And as long as he's relaxed, I will continue. He did a little licking. And I can remove my hand if I want to from the licking, but he's not mouthing. So I'll remove. And he relaxed. He's not totally relaxed because his head wasn't laying down to the bed. And then I'll start again. Like I said, long, slow, massaging strokes. And as he relaxes, I'm going to make my way down to his foot. And if he were to retract, then I wouldn't let him. I don't want him pulling. So I'm feeling in between each toe and in between the pads underneath to see if I feel anything. I don't feel anything in that foot. So I just set it back down and I'm going to go back to long, slow massaging strokes. You can do it at the chest. His ears are relaxed. His face is relaxed. He is in a relaxed state. All right, so you'd want to check each foot in the manner that I checked that first one. All right, so we're going to check that nose. Moist and cool, no discharge. If we've done our face conditioning properly, then we should be able to check his teeth. No problem there, as he remains calm. Then I'll do a little more massaging. If you know which spot they like the best, then I'll aim for that. And see if he wants to mouth, lick, I'll remove my hand. I'm just gonna block him from coming over. And I won't interact with him until he lays back down. I'm gonna ignore him, all right? I'm going to remove my hand. And he's mouthing, so I'm going to remove my hand. No interaction. He switched sides on his own. So I can check this side of his body. I'll remove my hand for the licking. So that tail starts wagging. He's starting to get a little bit excited. I kind of shifted my body because I wanted you to be able to see. Let me flip around to this side. So I'm going to ignore. The only way for him to get attention is if he's laying on his bed. And he laid back down. So I'm going to go back. So now, mouthing, I stop. This is why we do it in the evening time, and hopefully they'll be a little calmer. So I'm going to go to his chest. I know he likes his chest massage, and the slow massaging will hopefully help relax him. And as I massage, I'm going to go up his neck to his ear and check his ear. Good boy. Now, if we've done the puppy health checks when they were smaller, we've rewarded calm behavior. As they get older, we should be able to do it with less treats. I do not have a treat pouch on me because also you can cause the dogs who are food motivated to get overstimulated and not remain calm because treats are flowing. So most of the dogs are very tactile, meaning they enjoy the touch. So if he wants me to touch him and pet him, then he has to remain calm. All right. So we just try to feel all over their body, and I'm just doing a little bit of manipulation of his head and check the other ear. All right? So you want to make sure their ears are clean. If they come to the kennel once a week, they get their ears cleaned once a week. If we feel like they need it more, we may send equipment home with you to be able to do that. Now, groin area and their belly. You want to be able to check their belly to make sure there's no rashes, bumps, scrapes, anything like that around their groin area. A little bit of discharge is okay. If it's green or yellow and a lot, or there's constant licking, then there may be some sort of infection. Same with their eyes and nose. A little bit of discharge is okay, but you can check their eyes. All right, the best time to check the anal area is when you're outside for a park break. If you know what normal looks like, when they are going to have a bowel movement, their tail's raised, you can see their anal area very clearly. And if you notice any swelling or more redness than what it usually looks like, then we probably need to have it checked out. But you want to do your health check when they're calm and relaxed, not wallowing all over you. They can be laying in the floor, but I won't interact with him if he is in an excited state of behavior. If you're unable to sit on the floor with your dog, you can do it in a chair. It is a little harder to check the belly, but since the dogs come in close when they are wanting to dress, you can ask for that position. And again, I'm only gonna pet and touch if he's in a relaxed state of behavior. He's not real sure what I'm asking here. They can sit, that's fine. But again, I'm not gonna, hey buddy, touch if he's trying to mouth. Hey. Now, he's used to when somebody's sitting in a chair that he lays down and relaxes. Come on, sit. So you can give the sit cue. Good. So same thing. I'm gonna put my hand, right or left hand, under his chin. I'll have him turn, sit. Good. And I'm gonna check those teeth. And then I'm just gonna pet his head. So we can check the eyes. Good. And I'm gonna, if I talk to him, it's gonna be real low and soothing, not in an excited state, because he will get excited. And so now I'm gonna check his ears. Good boy. Good boy. Just real, we want calm behavior. So if I'm massaging his chest, and it does relax him, and as I massage, I'm gonna start going down, and I'll pick up that one foot and feel between the paw pads, and then I can pick up the other one and feel between the paw pads. Now, if he's licking while I'm touching his feet, I don't necessarily remove my hands. So I feel like he's licking because I'm touching his feet. So if every time he licks and I remove my hands, he's like, she won't touch my feet anymore. Very good. What a good boy. Good job. All right. So I just kind of put my hand under his belly to keep him standing. And I'm feeling between the paws. I didn't give him a cue. He just turned around while I was petting. So that was for biting at his tail. So I'm going to try to do some long, slow massaging strokes to calm him. And then I'll lift up the other back foot to feel between the pads and his toes. Now, if he lays down and then I start stroking the side, he tends to roll over on his side, and I can lift up a back leg to look at his groin area and on his belly to see if I see any of those bumps or rashes in the groin area. So, if you have trouble getting on the floor and getting up, you can do it in a chair, as long as bending over doesn't cause you any discomfort. But the calmer and the long, slow massaging strokes, that helps keep the dog relaxed. And I didn't have to use any treats to keep him in position, nor did I say wait. If he wanted me to interact with him in petting, then I waited till he was in a relaxed state and petting. Petting is a reward for the dogs also. So he was only reinforced when he was calm, meaning I pet him. He's heads down, relaxed now, and so I'll pet him. But if he's in an excited state, I'm not going to engage him, interact with him. I'm not going to use the wait cue because he's probably not going to listen to it. So I'm not going to use any words. I disengage with him, and I'll only engage with him when he's in a calm state. If you have any questions about doing this health check, please ask your trainers.